So here's to $400 in Styes.
Yes. Excise it. That's usually my thinking. Is it a billing thing?
Should we pop it out?
Should we pop it out?
Just pop it
Yeah,
out.
pop it out or pop a pill?
Oh my god.
You pill popping pimple popper?
Nice.
What causes it?
That's good. That's a good question.
Farts.
No, Mythbuster.
Farts cause everything, right?
They just cause infection.
Farts are just air feces.
They even destroy the ozone. No, not the
Yeah.
ozone. What is it? Is it the ozone they destroy? The methane gas? Cow farts?
Yeah.
Okay. Today, we're going to discuss a very problematic eyelid disease,
God. I love it.
the Hordeolum. In my professional opinion, it must be treated very delicately. Because basically, it's a great big zit on your lid. Hi, welcome to Days of Our Eyes. I'm Dr. King.
And I'm Dr. Cha.
And today we're going to talk about the most common lump on the eyelid you've ever heard of, the good old Stye, or the technical term, Hordeolum. But there's also one called Chalazion, or Chalazion. So what is it? Why'd you get it? How do you treat it? Stick around, we'll let you know.
Okay, so first question. What is a Stye / Chalazion / hoodlum?
Hordeolum.
Hordeolum.
So Dr. Chop,
Yes.
what is a Stye / Chalazion / Hordeolum?
Great question. When we talk about Styes, Hordeolum, or Chalazion, we're specifically talking about your eyelids, so the skin around the eyes. Just like the skin on our face and on our bodies, there are oil glands that help moisturize and protect our skin. We have similar oil glands in our eyelids, just like a pimple on your face or a pimple anywhere else on the body. Those things could get backed up.
I never get pimples.
Oh, I believe you.
Continue. By the way, these glands we're talking
You're so
about,
lucky.
we've talked about them in other episodes. Those are the meibomian glands. Those are the ones we're talking about in the eyelids.
Yes. So any of the oil glands in and around the eyes, the eyelid area, the adnexa, I guess, is that
Yes.
adnexa?
Adnexa.
Adnexa. The structures surrounding the eye itself, those can get backed up. The oil glands can get backed up. They can get red and uncomfortable. You can even form a head, like a pimple or a zit can. You felt pimples on your face, imagine it right, next to your eye, how uncomfortable and painful it is and how freaked out you can be when something like that happens.
Yeah, that's really thin, sensitive skin. So if you get inflammation and swelling in there, there's no place for it to go. So it hurts to blink with these things. That's the most common thing. I've got this painful bump on my lid, and it just showed up overnight. And that's a Hordeolum.
Yep.
Or a Stye.
Yes. Styes are like the layman or the common term for Hordeolum. Hordeolum is a medical term. Then what's the difference between a Hordeolum or Stye and a Chalazion, Dr. King?
Well, in layman's terms, Hordeolum's when it's basically red, inflamed, and infected. Now, a lot of times our body will go in and fight off infection, but it can leave kind of a bump there. So it's not red and painful anymore, but you still have a bump. That's the Chalazion or Chalazion. I learned Chalazion, but he learned Chalazion. Somebody out there will correct us.
Yes.
So, we just go with what we can.
Yeah, what works. So then a Stye...
One moment.
Oh.
Wait, we got
It can start like
Rewind.
like a pimple where you can feel
Rewind.
it kind of coming in, but no head, but it's still red and painful. And then it progresses to where it gets a head, where it's real nice and red and juicy, I guess. That's still a Stye or Hordeolum. When you get like a scar afterwards, and usually scars on our faces aren't, they don't have mass to it, but that scar tissue left over from a Stye or Hordeolum, that's what the Chalazion is. You won't always end up with a Chalazion. And
The goal is to avoid those.
yes, it really is. And there are different ways to handle either of these two separate conditions.
Right. So we've determined that we have these glands and they become infected, whether that's through, bacteria getting up there or some sort of debris that blocks up the gland, and then you swell and get the inflammation and that kind of stuff. So then what do we do about it? Well, we got to open up that gland and fight off infection. Some of the best ways to do that: heat. Think about just a hot compress. It's going to increase blood circulation to that area. By heating it up, blood is drawn to that area, which is going to help bring your immune response and start fighting off infection. It's also going to dilate the pores of any glands or hair follicles or anything that are on the lash line there. By dilating it, it lets stuff start to get out or drain out. So something like a hot compress. And by that, I don't mean just a warm washcloth laying on your face, because those cool off in seconds. So they're not going to transmit any heat deeper into the tissue. So you need something a little stronger. They actually make eye masks that you can pick up in the store or on or online that have like a gel in them. You put them in the microwave for 15 seconds. They'll stay hot for 5 minutes. Just lay that on there, and that's going to help draw that out. A lot of people say, well, should I use an eye drop? Like, you can if we have some drainage, but eye drops don't get in there very much. They're more surface because we're putting a drop on the eye. And remember, we're treating a problem in the eyelid, not the eyeball. So oftentimes, if it's pretty tender, or if it's swelling, multiple glands may be involved. If that progresses, the whole lid can become involved, and that's called preseptal cellulitis. That's a upgraded stage. That right there is an upgraded Stye. Oftentimes I'll use an oral antibiotic to get it into the bloodstream. Now we can get into the lid tissue and fight off the infection. Still using the heat along with it, because the heat will help keep things softened up too, to stop that hardening turning into a Chalazion.
Yes.
So one of my favorite treatments is to use an oral antibiotic, if it's warranted.
What if I could see the head? Can I just get my fingers or a tweezer to pluck it? Because I do that with my pimples sometimes.
You really want to do that by your eyeball? Yourself?
No.
There's your answer. Okay? If you go to your eye doctor and they can see it, they're under a microscope. That's a whole different situation. But to stand there in the mirror and take a needle to it, hey, not sterile. So you're sticking a germy thing into an infected area. Let's just add on to the infection. There are times that they can just be, drained a little bit. If we get into a big bump situation, then they can be excised. We have surgeons in our practice that will actually, in office, in the eye lane, can incise, cut into it, get the junk out, clean out that hard material and any other stuff around it, and then let it heal to get rid of a Chalazion or a long-term bump. We don't do that in the acute phase. You want to do that after the infection's settled down, because otherwise you're just cutting open infection.
How do people get these bumps on their eyelids? I know that sometimes it's not washing their eyes. We're not going to talk about lash extensions and mascara in this episode.
No.
But, what are those things that can cause these bumps?
Anything that can introduce stuff to the lid margins that shouldn't be there. Most commonly, excessive eye rubbing. So you might start out with an allergy attack. Your eyes are itching. Well, now you're rubbing and boom, you've introduced bacteria and we get an infection. Some folks will go through periods of time where they get a bunch of styes, and that's usually because there could be a condition called blepharitis, where we actually have a dandruff situation in the eyelids. You have to keep that stuff cleaned off, or else it can breed the bacteria that turn into the Hordeolum. What else?
Something to say, but I forgot it.
I'm so wise that my words just wash over you and you forget your own thoughts.
That's it.
Yeah.
You buy that? You buy that?
Yeah, for sure.
Okay.
I know that's what happened to me. Are they contagious?
Styes are not contagious.
If pimples were contagious, then it'd be a bigger deal.
Yeah. Although, wasn't there a bacteria called acne vulgaris or something like that.
That sounds familiar, actually.
I
don't
think
know.
that's legit like pimples.
I think that's here, but we don't really associate acne vulgaris with on the eyelids. That's why, like, when I was a teenager and I'm getting zits here, I wasn't necessarily getting on my eyelids. Different skin, different pore sizes, different pH to the skin, different conditions. So when I started on a thought process, some people will go through a period of their life where they'll just get styes a lot, and then it goes away. I often hypothesize maybe that there is some body chemistry changes that maybe make us a little more susceptible or prone at certain times.
Right. And your environment's important as well. During the pandemic era, we wore a lot of masks.
Oh yeah.
And so airflow, right, was contained within our mask. Because a lot of times, if the seal wasn't tight, it flew upwards or blew upwards. There are actually studies and articles and prevalent studies about how, and we talked to our colleagues. There's like, a bunch of people are getting Hordeolums and Styes and Chalazions, or mainly Hordeolums and Styes. Now, because of all the extra airflow up towards their eyes and eyelashes, it dries them
Forgot
out.
about that.
And introduces more bacteria to our eyelashes, eyelash follicles, those glands, and people get them.
I forgot about during the pandemic the maskne they used to call it. Maskne.
So if you work in like a healthcare environment where you are wearing masks and such, hospitals, urgent cares, the like, emergency, you might have a higher prevalence, more instances of getting these styes. The preventative measures, or practicing good lid hygiene is going to be that much more important. If you wear makeup, make sure you're doing your very best to make sure you get it all off. There are even lid scrubs, medicated lid scrubs, like OcuSoft lid scrubs or Avenova solutions that are specifically formulated for the chemistry of our eyelids to really clean up and break up any oil debris that collects there.
I personally do a lid scrub every day, just because otherwise I will get into a blepharitis situation. So anyway, that was our Babylon about Styes and Chalazions or Chalazions. If you like what you heard today, please hit subscribe. If you have any questions, don't hesitate to drop us a question in the Dropbox. And in the meantime, I'm Dr. King.
And I'm Dr. Cho.
Have a great day.